the genetic factor then, is there actually a way that we can break the cycle? Is it about, we can get to a certain point and then suddenly it doesn't become a factor? Or is it more about mass scale awareness, making, treatments like we have at Trifixx the standard? That's kind of the way to move forward.
Olivia, part of our treatment programs in our standard medical practices in severely ill patients is that we do DNA testing. You only have to do DNA testing once in the patient's life because you cannot change the DNA yet. I mean, perhaps in another 100 years we can reprogram the DNA, but right now, and we can't. So we're left with the problem of faulty DNA, which is the genetics. We have to deal with it. So if you're born without an arm, which is a faulty DNA, right? I can put a prosthetic arm, but you're not going to grow another arm.
Yeah.
If that explains it more succinctly. But I can live with that arm for the rest of my life. I can live with the correct sort of supplements or the correct sort of nutraceuticals or the correct sort of medications for the rest of my life to overcome the genetic defect that I have inherited. By the way, in the DNA genetics, we can tell whether it's from your mother or father or both. Yeah. And we do have effective treatments for some of the genetic autoimmune illnesses that are available through our medical team that are very, very effective, where we take the signaling from the DNA, which is called the RNA, and which is a chemical signaling, electrical signaling, and we supplement it with very, very targeted medications that correct the signaling of the DNA, but we cannot change the DNA. We can only correct the signaling. But for those sort of things, you have to go to one of our doctors for.
At
NITEC. Yeah. But Trifixx is for everyday hypothyroidism.